Michigan who gets tested, who doesn't. And it's not a license to say, okay, if you're negative, you don't have to follow the rules of social distancing. The only way out of this is social distancing.
And today we heard the New York Governor Andrew Cuomo say that doctors are going to try experimenting with putting more than one patient on a ventilator. How unusual is that, and how does that work?
I can say that as a person that's been caring for patients in the ICU that are critically ill, that need ventilators all the time, I'm not so sure I know how that's going to work, to be honest. So I think we're going to have to wait and see how rationing and sharing ventilators is going to work in New York City, because their ICUs are getting crushed and they're going to be making hard decisions. I know Governor Cuomo has been working and leading on this effort in incredible ways. He's been citing this need for ICU surge capacity. As an ICU intensivist, I can say he's messaging on the right thing. We want to save lives, and we're going to lose Americans unnecessarily if we're not thinking about ICU surge capacity. But to answer your question, I don't know how we share ventilators amongst patients, because you know what? We haven't had to do that yet. As far as in the last 80 years, at least since World War II, we haven't had to talk about rationing critical life-saving supplies, medical or otherwise. So who really knows?
You know, we've also heard Governor Cuomo call out the president for not enacting the Defense Production Act. What do you think that the government needs to be doing to shore up resources here?
You know, again, this goes back to your original question. What should we be doing? We should be doing a national lockdown. What should we be doing? Well, we should be actually implementing the Defense Production Act. This is not complicated. I don't understand why our federal leadership is struggling with this, nor do many of my colleagues in public health. We need more ventilators. And yes, some companies are really stepping up to the plate and doing it, but they're doing it on their terms. We should be doing it on the terms that are needed. And the federal government has the power to say, no, in fact, we need to co-opt your production mechanisms to produce X amount of ventilators on the order of hundreds of thousands. This is what we need. We need 700,000 ventilators. If this is going to be the type of outbreak we fear it may be in worst case. So the only way that gets done in 2 to 3 weeks, or rather in 2 to 3 months potentially, is through the Defense Production Act, implementing it. So that's the problem here. That's what we need. We need more masks. We need more than companies are saying they're willing to produce. We need to tell the companies how much to produce. So this is not hard. This is really not hard. And if President Trump is so focused on the political optics here, him being strong and taking a strong stance on lockdown and on the Defense Production Act, implementing it, would actually improve his standing in the American public, in my view. And so he should really take these decisions, I hope, seriously and to heart.
And Doctor, we're in this time where so many people are looking for any type of silver lining wherever they can find it. There's some very early research that seems to suggest that warmer temperatures, warmer weather might slow the spread of coronavirus. What do you make of that?
You know, I'm one of those that is bullish on the notion that coronavirus seems to do well in ambient temperatures, 55 to 75 degrees. And can stay on surfaces up to 24 hours in the case of cardboard, a few days in the case of plastic. But that as it gets warmer, some studies suggest that, yes, it doesn't survive. And so once we start hitting 80-degree weather, do I think we're going to see less transmission? Yeah. Do I think there's less transmission happening beneath the equator? Yeah. And so is there something to this? Potentially there is. But there's some studies that also counteract that. So again, I hate to say it, we're just in a space where there's no definitive knowledge here. But there are compelling studies that suggest warmer weather might be a balm. And I personally am one that believes we will see some relief in transmission rates as it gets warmer.
And we've also seen cases here in the United States top 50,000 today. Is that a big rise in cases because more people are getting the disease, or because more people are getting tested?
I think you nailed it with the first suggestion that this is probably us hunting for the disease. We're lagging this disease in so many ways. one fundamental way is that we weren't looking for it. Now we're looking for it. So of course we're going to be detecting a bunch of it, especially if we assume this is transmitted in a widespread community type way, that we're basically seeing wherever you are, it's being transmitted, whether it's in the grocery store or a restaurant, what have you, nursing home. So yes, I think we're only going to see cases continue to skyrocket in the days and weeks ahead. But we should be cautious, because does that actually mean it's getting worse, or are we just, again, catching up to a reality that already exists? And I happen to think it's the latter.
I had a nurse friend of mine that told me, we were talking about the numbers, and she said that you can't really trust the numbers of people infected. The only number that you can really take to the bank is the number of deaths so far. And she said you should just assume that it's everywhere. Is that pretty accurate?
I think we're at the stage when we're talking about national lockdowns, sheltering in place. Those types of policies only come to be if we are assuming there is community transmission. In other words, wide transmission. It's everywhere. Let's just try to get it out of the ecosystem. That's why we're saying let's not interact with each other. If this was, well, let's just be nuanced. Let's try to find a few cases here, quarantine them, a few cases there, let's quarantine them. That's containment. That's what South Korea did. That's what Singapore did. And they were able to rapidly contain the disease. We're in mitigation. We're basically saying, let's flatten the curve by socially distancing, because we're assuming it's everywhere. And so yes, I agree with your friend here. This is widespread. Deaths are going to continue to climb. Cases will continue to climb. The question here is, what's the true infection fatality rate of everybody that has it? How many people are dying? We have no idea what that number is.